Wayne Gardner, I'm Chairman of the Board of Chester River Health System. Very soon to be Shore Regional Health, of which I will no longer be chairman. The establishment of Kent and Queen Anne's Hospital in 1935, this community's healthcare needs have changed, generating greater need of increased health care in this every passing decade. To meet the needs of our patients, services were enhanced in 1997. Chester River Health System was formed, encompassing the hospital, a home care and hospice organization, a nursing and rehabilitation center, and a hospital foundation. In the years that followed, this community saw additional changes as Kent and Queen Anne's Hospital reinvented itself as Chester River Hospital Center, and then as a system affiliated with University of Maryland Medical System. Today, July 1, 2013, we embark on a new era for healthcare in the Shore. The collaboration that has brought us together, this affiliation with Shore Health, is something we have been preparing for since December 2011. 18 months we've been working on this. We are confident that the work we have done to get to this day enables us to provide seamless and efficient care across the region. Together we can reach levels of quality for our residents and our community that our community deserves. This is sort of bittersweet for me. I've had the privilege of leading this organization for 5.5 years. When I say that, I mean that. It's been a privilege. In some way, shape, or form, I've been associated with this hospital for 40 years. I just told you almost how old I was. My kids were born here. Grandchildren have been born here. I truly believe that we're heading in a direction that's going to be good for all of us. More importantly, not for me, for this community. I think we can deliver health care to this community and the 170-some thousand folks that we're having to deliver health care to. And I think this is just not a community. It's not about Chester County. It's not about Easton. It's not about Denton. It's not about Cambridge. It's about 170,000 folks that we're going to try to deliver health care to. We have a fantastic leader to help us do that, Ken. We have a wonderful chairman to help us do that, John. We have a partner at the University of Maryland Medical System that's not only the best in the state of Maryland, in my opinion, the best in this nation. So we have something to be proud of in the past. We have something to truly be proud of in what's going forward. Thank you all very much for allowing me to lead you. This time I'd like to introduce John Dillon. And he won't pay any attention to any of his talking notes.
Thank you all for having this reception today. It's wonderful. I am the chairman of Shore Health System, and there was a drawing and Wayne won, and I'm the chairman of the new center. So you're stuck with me for a while anyway. In thinking about today and what I might say, I was thinking about reflecting back on healthcare and what's going on in healthcare. And when you do that, you come up with two words: change and challenge. And that's what we're facing in healthcare. And no matter how you look at it, it's almost unprecedented, the amount of change and challenge that we're facing in the healthcare world. Not only here locally, but in the state and in the nation. It's going on all over the place. And as I said, it's unprecedented. And I do believe that we are in the best position going forward to address those challenges and to take on those changes that we're going to be facing. And as you look out into the future, I don't see any relief in sight. I think we're going to be facing challenges and change for quite some time in the healthcare field. So I think as we combine and get together as one team on the mid-shore, we're putting ourselves in a much better place to address the challenges and changes that we have to do. And then to have a tremendous partner like the University of Maryland Medical System to work with as we go down this road, I think we're in awfully good shape to do it. It certainly today is a step in the right direction. I had the pleasure of being on a team that worked toward getting us to this day. And this is a big step forward, but it's not the end of our journey. We've got a lot of other things that we need to do going forward, and we will get those done. But it was a pleasure to work with the folks from Chester River Hospital and the folks from Shore Health System, and together we were able to get to this. And we turned to, almost from the first day we got together, and it wasn't whether we were going to do this thing or how we were going to do this thing. And we really did work together to get there. Now there's a lot of work ahead of us. The medical staffs have to get together. We have to look at services and do these things. But I can tell you going forward, the community is very, very important. It's not only important to Wayne and myself in Shore Health and Chester River, it's important to University of Maryland Medical System, because we have a legacy in these communities, and we're going to do everything we possibly can to create a network going forward that's going to provide quality services to the people.
And it's really a pleasure and also a real privilege to come down this afternoon and see this, recognize this very historic moment coming together in Chester River and Shore Health System. This is a big deal for this community. This is a big deal for the University of Maryland Medical System, and we're just proud to be CEO of the University of Maryland Medical System. I've been very proud of the progress that both of these organizations, both of your organizations, have made here in recent years. You should be very proud of it. And following this merger, Shore Regional's health network of healthcare services across the Mid-Shore region is going to grow. And I'm proud to see that we're in Caroline County, we're in Dorchester County, we're in Kent County, we're in Queen Anne's County, and we're in Talbot County. So it's, this regional concept we think will create a much stronger enterprise here down the road. So together, and I think that's an operative word, together the combined resources of both organizations now are really just going to be totally focused on the growing healthcare needs here of the Mid-Shore area. An important goal of the University of Maryland Medical System is to provide very high quality, and we like to say high-touch healthcare in each community that we have a presence in. And in addition, we work very, very hard to deliver ready access to a very wide network of physicians and health services, not only here in the Mid-Shore, but out across the state. And for us, the anchor is the very cutting-edge medicine provided up in Baltimore at the University of Maryland Medical Center, which is staffed by the world-class faculty of the University of Maryland School of Medicine. They are there for you. They are backing up this entire Shore and Chester River organization, so I want you to know that. And in short, the entire University of Maryland team, and we have 12 hospitals and over 20,000 employees, stands behind you every day and is fully committed here to the future success and growth of the new Shore Regional Health System. So let me conclude my remarks by emphasizing that the University of Maryland, the entire team, is very, very pleased to be part of this historic day and to be your partner in enhancing healthcare on the Mid-Shore. And I want to thank everybody that came out today to join this event. It means a lot to me. I know it means a lot to this community. And I want to thank you again for everything that you're doing for all the communities across the Mid-Shore. And finally, you need leadership to carry an organization like this forward, and we cannot think of a better, more visionary leader for Shore Regional Health than Ken Kozel to guide us through what John Dillon said we think are going to be pretty difficult and challenging times going forward, but we think we have that leader. Let me welcome Ken Kozel here to the podium, the President and CEO of the University of Maryland Shore Regional Health. Yeah.
Bob, I'd like to thank you, and also thank you for reading that last bullet point that I wrote for you. I appreciate that very much. Great job. Thank you, everyone, for coming out this afternoon. What many of you most likely don't know is that before I came to Shore Health in October of 2011, one of the first introductions I had to this region was joining the Regionalization Study Committee that was formed to create Shore Regional Health. We spent some time over the summer before I was hired here, and I got a chance to know and learn and watch the board chairmen, Mr. Wayne Gardner, Mr. John Dillon, in action. I got a chance to see University of Maryland representatives, Mr. John Ashworth and Dr. Glenn Robbins, talk about a regionalization for the Mid-Shore region. And I have to tell you, I was extremely impressed at what I saw, what I heard, and what I learned. There is a passion, there is a commitment, there's a dedication to our success here on the Mid-Shore. It starts as high up in this organization as you can imagine, with Mr. Krenzik, with our board chairman, and with the board members that were part of the study. It has then since trickled down to every board member that is in both organizations yesterday and that is now in both organizations today moving forward. We have a committed board of directors with a committed board chairman who is going to help us create a regional approach to healthcare here, and we will be successful in doing that. So I'm extremely proud to be here today. I'm very thankful for all of you here today, and as I look across the room this afternoon, I can see that it's not only going to be our board that's going to help us succeed, it's not only going to be the University of Maryland Medical System and our senior management team that's here today that will help guide us, but I really think it's everyone in this room that's going to help us be successful. You heard Mr. Dillon talk about change and challenge. He is absolutely right. You can't pick up a newspaper these days without learning about healthcare and some of the struggles and challenges we have in our organization. But it is about change and challenge, and it's also about partnering with our community. And many of you in this room are going to be critical to our success, from our local elected officials, to our partners in the healthcare communities, to our team that is now over 2,500 members strong as part of Shore Regional Health. You're going to help us succeed. I get the benefit of standing behind podiums and sharing our successes, but it's because of all of us in this room and everybody that's not able to be here today that is going to help us be successful. So I'm extremely proud. I'm extremely thankful for this opportunity. I also thank Wayne and the Chester River Board for handing off an organization that's very strong in our community, and very strong from a quality of care perspective and from a patient care perspective. So I want to thank Wayne and the board for doing that, and we promise on behalf of the new Shore Regional Health to do our absolute level best to continue that success, help overcome those challenges that we're going to face, and continue to be enormously successful as part of the Shore Regional Health System, 5 counties on the Mid-Shore. Thank you again for being here today. We greatly appreciate it.